people coming into the United Kingdom.
Thank you. And what's the actual number? On the 16th of April, the Health Secretary said it was 15,000. What's the actual number now?
The actual number of people coming in as of Friday, the 24th of April, was 9,906.
Great. And what's your estimate of the proportion of people arriving at ports and airports with coronavirus?
Well, we don't have that data because it is a fact that obviously we don't have our overall approach to international travel and checks at the borders have consistently been informed by SAGE, the scientific and medical advice provided by SAGE and Public Health England. So there is no testing at the border, and that is a cross-government decision based upon SAGE advice and medical advice, and also with the Department of Transport. I think I should also add around people coming into the country, let's not forget that we do have people coming in driving goods. Obviously security of food supply, medical supply, etc. has been pivotal over the last 6 weeks, and so that is also something that has been factored in terms of the number of people coming into the United Kingdom and why they're coming into the UK.
Sure, but I'm just trying to get you must have an estimate. I mean, surely you must have some estimate, or SAGE must have done an estimate, or somebody must have done an estimate, because you would need that on which to base your policies on whether to ask people to self-isolate or to have quarantine rules at the border. You must have an estimate.
So the fact of the matter is, SAGE work on the numbers, and obviously for them it's the R value, obviously the reproduction value in terms of based on the lack of flow basically coming into the border, because as we've already said, passenger numbers are down at the border. But notwithstanding that, we have to remember that they have basically said that based on their advice has been not to bring in any changes in terms of testing or things of that nature, and we're following that advice. And any restrictions that they've looked at, we commissioned this several weeks ago. Scientific advice has been very clear that any restrictions or measures would have a negligible impact on the progression of the virus at the border, given the significant reduction of numbers of people arriving in. So that is basically what SAGE have been basing their advice to governments on.
But in order to come to that conclusion, they must have an assessment of the proportion of people who have coronavirus. I mean, you have flights from New York where the New York governor, people have talked about prevalence levels now being around 20%. We've had through this period flights of people coming home from Spain or from Italy. You took a decision not to have self-isolation rules at the border in the way that other countries have, but I presume that was based on some sort of figures or estimates about what proportion of people might have the virus.
So my understanding is from the SAGE advice that has been given to government that the estimate was 0.5%, and that has effectively led to the decision, based on the advice that we have had from both SAGE and Public Health England, that no changes would be required.
And is that 0.5% of passengers arriving at airports?
That is 0.5% of the total number of people.
Total number.
That's my understanding. That is my understanding.
Okay, this just seems as something, sort of thing that'd be very helpful to have some accuracy on.
Well, we will provide that. So I'm very happy to get that figure for the committee. My understanding is, in fact, I've just been told that is based on the exact number of symptomatic people is in the low tens, but I will get clarity for the committee in terms of the actual figure that is used by SAGE, because I think that is what you're asking in terms of your question, that is used by SAGE, that has therefore been factored into their calculations based with the R factor in terms of that then led to the decision and the advice that they gave to government, basically, in terms of not to bring in restrictions or measures.
Why haven't you published that advice?
Well, that's not for me to publish, and my understanding is that SAGE will be publishing. They are publishing data and they are publishing scientific advice, and so that'll come in due course. But I am absolutely clear, I have been told that SAGE are publishing data specific to this, I'm sure that advice will be published, but as I have said, I will absolutely get that figure that has been used as part of the equation for the R calculation that then led to obviously their decisions, their advice around public health recommendations. We will get that for you.
So the reason that this is significant is obviously Germany, New Zealand, South Korea, Italy, Singapore, Australia, Canada, Greece, all these countries ask people who are arriving back in the country, people are travelling home from all over the world, to self-isolate, maybe for 14 days, and we don't. And you said it's the science, but is our science different to all of theirs?
Well, I think these are questions absolutely for SAGE, but I think there are some fundamental points that we must all recognise and note here. Every other country has been at a different stage in terms of the virus and the peaks in their own country. And SAGE and our scientific advice can only base their recommendations to ministers and to government based on the data that they have at a particular time. So we're going back, obviously, to that end of March period, when that advice was commissioned and that advice was provided to ministers. It might be worth noting, I mean, even if you look at a country like Italy that took very restrictive measures, it did not necessarily stop the spread of the virus. So every country has been at different stages. Every country takes different scientific advice and they have to make their own judgments accordingly. And we've done exactly the same. So I think much of the advice will be forthcoming. As I've said, SAGE will be publishing that, and some of the data that they've been using in terms of the data that has helped to inform their positions and decisions.
The countries that I listed, Germany, New Zealand, Italy, Singapore, South Korea, they're all in very different positions. Some of those have been ahead of us and some of those have been behind us. But all of those countries have policies around self-isolation, simply asking people who come into the country to self-isolate for a period. They've been travelling by plane, they've been coming from an area with higher risk. According to some of the evidence, 130 countries have more restrictions than we do. And Professor Gabriel Scally, who's the President of Epidemiology and Public Health at the Royal Society of Medicine, has said the UK is an outlier. It's most peculiar. Of course, it's not going to do the job on its own, but all of these things are additive. It all adds up to beating the virus. The problem with simply saying, oh, well, it's all for SAGE, and then not publishing the SAGE evidence is that in the end, you're the Home Secretary taking these really important decisions. Surely you have a responsibility to put this information into the public domain, regardless of what SAGE say, because this is crucial evidence to substantiate the important decisions that you are making as a minister.
I think, first of all decisions are made at a cross-government level, and that is exactly what we have been doing as ministers across the whole of government. This is about the effort of one government department. These decisions are made collectively. And let me just remind the committee and be very clear that scientific advice that isolating incoming travellers, the science has been clear, SAGE have been clear to us, as have Public Health England, that this would have a negligible effect on the progression of the virus in the UK. And they base that given on the significantly reduced numbers of passengers arriving to the country, and also levels of the relatively high levels of transmission of the disease in the UK. However, I think as ever, with any decision, any policy around coronavirus, everything is under review. And we review decisions with SAGE. SAGE met yesterday. SAGE will meet later on again in the week, I think tomorrow. Everything is under review based on the most appropriate response to the changing situation in relation to COVID-19. And of course, that does come back to the R factor as well.
Doesn't it worry you, Home Secretary, sorry to interrupt, but doesn't it worry you that all of these other countries clearly have different science to the advice you've been given? Have you asked other countries what science they're looking at, just to double check that you're getting the decision right?
Well, I think, of course, we work with our international partners, and I think actually that's an important point to make here.
Have you asked for their evidence and their science?
I speak to my counterparts, particularly in Europe, frequently.
Have you looked at their particular science, their guidance, their assessment about why they think it does prevent the virus spreading faster to have these self-isolation rules in place? Have you asked Germany, or have you asked South Korea or whatever, what figures and science they're looking at to make these decisions?
Well, I think, first of all, we are not similar to many of those other countries. I think we should be very clear about that, just in terms of traveller and passenger flows. It is It is a fact that the UK has one of the largest number of international arrivals, very different flows to some of the countries that have been mentioned. And that obviously is a key consideration of SAGE. Now, key to that is how we work with SAGE, and we have been working with SAGE. I think this is a cross-government effort. You know, we make these decisions collectively. This isn't just for one department in isolation to single-handedly say, we are going to do X. This information is calibrated across government with SAGE, but also with other government departments. And we have been compared internationally. I mean, if you look at some of the charts that even are shared on a daily basis through the government press conferences and the way data is collaborated, we are compared internationally. But the fact of the matter is, we work with SAGE and Public Health England. This is advice that we are taking from them.
Sure. So when's that?
I've already said that will be published. I can't give you a specific date, but I'm very happy after this committee to get you a specific date if that's what you'd like.
That would be really helpful, because we have been asking for this information and this analysis for a long time. Ruth Edwards.
Thank you, Chair, and thank you very much, Home Secretary, for making yourself available at such, I know will be a very busy time for your department. I want to carry on the issue of border controls, because it's probably one of the issues that has come up most in my inbox. Constituents really are very, very concerned. I completely, obviously, support basing our policy on scientific advice, but I think when it seems to run so counterintuitively to what people perceive, I think it's really important that that advice is published and made available to them. So I welcome the commitment that it will be. In particular, I wanted to ask about comments from the Deputy Chief Medical Officer, Jonathan Van Tam, who said that the risk of infection from overseas arrivals remains minuscule at the moment relative to in-country infection. But he did add that screening at airports might become an option once the overall in-country infection rate had dropped. And I was wondering, how will that risk be determined, and under what criteria would quarantining arrivals become an approach that you might consider?
Well, I think first of all, those comments were made a few weeks ago, and of course, those comments were also made based on the SAGE evidence that has been that I've referred to in the medical advice. And today is the first time that I've heard the request from the committee to publish that. So obviously, we will follow that up through our perm secretaries. I think first of all, it's important to recognise, notwithstanding public perception, the point about not screening passengers on arrival. We've had low passenger numbers, obviously, and that would simply not make a material impact. There have also been queries and questions amongst the medical and scientific community about the value of thermal screening, whether or not that's going to identify, whether or not it would give false positives. There are a range of issues around that, and also it's easy to circumvent by taking fever suppressing drugs, paracetamol and things of that nature. You specifically asked, under what circumstances would measures at the border, such as quarantining, apply, and then can't come in? Well, first of all, that would still be based on the science. It would also be based upon any changes outside of this country. For example, as easements to lockdown may take place with other countries, and more people perhaps will choose to travel and choose to fly, we still rightly so have to think about the impact of a second wave. We've gone through a great deal of grief and hardship in our country, and I think the public response has been absolutely extraordinary. The support to staying at home and listening to the advice of the medical advisors, scientific advisors, Public Health England, as to why we need to protect the NHS by not overwhelming it. And of course, that would be a crucial component to this, along with, as government has outlined already, the 5 tests, making sure that we can continue to protect the NHS, that there is a sustained and consistent fall in the daily death rate, and showing that the infection rate is decreasing. Showing an infection rate decreasing domestically obviously means that we want to prevent that second wave. So this is under discussion. I can confirm that, and I mentioned earlier on that we are reviewing everything. We have to do that. It's a right and responsible thing to do. Reviewing the science, obviously, science from 3 weeks ago can differ from 2 weeks later. And let's not forget, even in the data that does come forward, on issues such as the daily death rate, the impact of the virus across the country, there is a lag in some of that data coming through as well. So we have to work with the scientists, work with the data, and also look at the operational side of things. This isn't something that could just come in overnight. We will have to think about the practical measures of this, how this would be delivered, which kind of ports of entry first and foremost, and how that would work from a practical basis. But we rule nothing out at all, and it is right and responsible that we can keep these measures under review.
And are you preparing some of your key teams, such as the border force, in any way in case they do have to enforce quarantine at the border in the future?
Absolutely. And border force have been part of this active discussion over several weeks. So let me be very clear, this isn't something that has manifested itself overnight. I commissioned the discussion 6 weeks ago in government. And so this has been an active discussion. I led the discussion with border force across government, so with Cabinet Office in particular. So this isn't just the Home Office on its own. This is a cross-government discussion led by the Cabinet Office with Department of Transport. And in fact, Department of Transport as well are working with us on this and have been over the last 6 weeks, as have the Department of Health and Social Care. Yes, because we work to the PHE guidance, but also to the medical and scientific advice. But of course, they have clear views on this as well. And as ever, with the efficacy of whatever decisions are made and how that's published going forward and how that's operationalized, we have to base our decisions not just on personal preferences or anything of that nature, but we have to base this on sound facts and sound science and what this actually means with flows of numbers coming in. And it's not just airports, by the way, of course, it's ports.
Of course. And final question from me. You mentioned how fantastic the public response is, and I agree, but in order to enforce social distancing and to make sure that people are staying at home and protecting the NHS, we need public consent to do that. And as you say, we've had a huge amount of grief and hardship in our country at the moment. I appreciate that passenger numbers have declined a huge amount, but given that you only need a small handful of people coming into the country with the virus to restart another outbreak, do you think there is a danger that if we don't properly explain to the public why we're keeping the borders open, if we don't bring in or consider more carefully bringing in quarantine measures, that we may lose public consent? People will feel, why am I having to stay at home, not being able to see my grandchildren and the people I love, when we've got people arriving in from coronavirus hotspots every day with no quarantine measures placed on them at all?
Well, I think first of all, and we can, I'll bring in Shona Dunn shortly, because obviously she oversees some of the borders work here. I think first of all, March seems like a long time ago. We're at the end of April right now, and so much has happened. I think the British public have been incredible in terms of their spirit of national unity and the way in which they themselves have taken responsibility, personal responsibility themselves. When this first started, and this wasn't just at the end of March, but if we recall going back into February, we did ask people to self-isolate, people coming back from Italy in February and March, if you recall, and we found places for travellers to self-isolate and effectively then quarantine. But when community transmission accelerated at quite a rate, the need was much bigger. But the point is now, as you have highlighted, we're heading into a different phase of this virus. And with this different phase, that means different measures will, I think, inevitably come in. We should also emphasise as well, I'm going to come back to the point that I made earlier on to the chair, the largest group of nationals arriving to the UK have been British citizens and other resident nationals as well, people travelling back as measures were closing down, particularly towards that end of March period. But as I've said, all of this is under review. Shona might want to elaborate on some of the measures that could come in and how we would operationalise that. And with that, of course, this comes back to the practical ways in which we operationalise, and then, of course, how we communicate that. It's both to the public, but also internationally to people that may be looking to come into our country and under what auspices they will be coming into the country. And let's not forget, one of the key points I've made is that we, focus on repatriation of British nationals, but we also focus on keeping ports open to keep goods flowing in particular. 7 weeks ago, we were seeing panic buying. We were seeing our supermarket shelves clearing out pretty rapidly at fast rates. If you look at what's happened since, we've kept the supply of goods and medicines coming through. So there will have to be communications around this, but I'm sure Shona, if Shona can come in, she can speak about some of the border management as well, and some of the work that we've been doing.
Thank you. Shona Dunn.
Thank you very much, Home Secretary. Thank you, Chair. Just to clarify one point that came up earlier in the session, Chair, the 0.5% figure from the 23rd of March was essentially the 0.5% of total cases at the time in the country, I think was the conclusion of SAGE.
So does that mean it's a much higher proportion then of the number of people entering the country?
So I don't have the figure for the proportion coming into the country. We would be able to work that out, but just to clarify, that was the point at the time.
Okay, but this actually is quite serious. I don't understand why the Home Office doesn't know what that figure is, what that proportion is, that estimate for the number of people coming through our ports and airports, a lot of them who will be coming home, as the Home Secretary has said, being repatriated and so on, but what proportion of them might have coronavirus? Why don't you have that figure? Why haven't you been testing and shaking that figure continually as part of your decision making?
So that obviously that 0.5 figure at the 23rd of March, the numbers that are coming into the country post that period, Chair, have also gone down significantly. So the numbers coming into the country at that point were higher.
But I'm still asking,
and they will keep moving.
Yes, but I'm still asking for a factual question. Your estimate of the proportion of people entering the country who may have coronavirus.
We do not have an estimate of that figure, and we have not. Our Chief Scientific Advisor is very heavily involved in the work with SAGE. We have not got an estimate of that figure. The point remains, as the Home Secretary has said, that we have been working to advice provided by SAGE that this is a negligible effect on overall transmission in country, and we have been working very much to the guidance provided by SAGE and the government guidance on when to test. So that has shifted.
Okay, and that 0.5% is what in absolute terms, in total numbers terms, what does that translate into?
I don't have the figure. Obviously that was 0.5% of the total cases in the country on the 23rd of March. I do not have that figure as a number. I can get you that figure as a number. It is not a figure that Home Office generated, and I don't have it in front of me, but I'm more than happy to get it to you. It would, of course, be the figure at that point in time on the 23rd of March, and things have moved significantly since then.
So what would be really helpful is to know what the figure was at that time, what the figure was previously when you took the decision about the policy, and also what the latest figure is in absolute number terms, because obviously a very small proportion of a very large number could still be a lot of people. We can't tell from what you're saying whether we're talking about small numbers of people or large numbers of people.
So I'm more than happy to see if those numbers are available, Chair, and to get those to you if they are.
Thank you.
Going back to the point that the Home Secretary raised with respect to measures at the border. So as the Home Secretary said, Border Force has been very, very heavily involved in ongoing conversations, as you would expect, across government on the measures that could potentially be put into place. As the Home Secretary said, there are a number of those measures where there are potential significant downsides. There are some measures where at particular points in time, depending on appropriate triggers being reached, it might be sensible to bring those measures in. That's a very, very active discussion. Border Force are engaged, as the Home Secretary said, with DHSC and with DFT on a whole variety of different dimensions associated with that, including, for example, what information Border Force officers may have to take at the border, what the operational requirements on them would be in order to be able to do that, what they might have to ask people to do once they left ports of entry. Also questions around, for example, exemptions, the sort of exemptions that you might need. We've also been thinking carefully about how that might progress over time. So Border Force are involved, all of their technical experts and operational experts are involved in that process. then, as you said, critical factor for border force on behalf of government has been keeping borders open for those key things that we need to keep coming in.
Thank you. Stephen Doughty.
Thank you, Chair. I'm confused, Home Secretary, because what were the decisions based on before the 23rd of March? Were you sampling international travellers coming into the UK in terms of coronavirus symptoms or subsequently developing them?
No, I've already said there was no testing at all that was coming through. And previously, before that date, if you recall, there were certain there were flights coming in from certain parts of the world, just as this virus was really gripping the world in other countries, or we had become submerged by COVID in that sense. We were quarantining individuals, people that were travelling, and I can't recall the locations where they were coming in from, but there were certain parts of the world travellers were coming in from where they were being quarantined. That was prior to, if you recall, prior to that lockdown. And if memory serves me correct, I think that was sometime in late February.
Home Secretary, I'm surprised that you can't recall where they were being quarantined from, given that you're responsible for the border, because they were being quarantined from Wuhan, but they weren't being quarantined from northern Italy, from New York, from Madrid, and many, many other locations. Why was that the case? Why was only Wuhan being quarantined, but not some of the other high prevalence areas?
Well, if you recall at the time, the focus was on Wuhan. Of course, we were bringing back British nationals who had been in Wuhan through many of the repatriation flights that were taking place. And that was the focus. I mean, there is a timeline of activity in terms of the disease and where it was emerging from, and the categories of, well, the countries in particular, the hotspots at the time.
But the hotspots, Home Secretary, were already in northern Italy with substantial numbers dying and infected. Madrid, obviously 3,000 Atletico Madrid fans came in on the, I think it was the 11th of March, I think, for the match with Liverpool. There were many, many other instances of high prevalence areas. Why? Who took the decision that only the flights from Wuhan were to be quarantined, but not some of these other key prevalence locations?
Well, I think at the time, let's be clear, Wuhan was obviously in the spotlight, and we were bringing back, the Foreign Office in particular were working night and day in terms of bringing back British nationals from those particular countries. We were also seeing that graduated decline in passenger numbers. But of course, much of the decision, I've already mentioned SAGE, but this was based on Public Health England advice that came into government at that particular time. And of course, we've been following the advice that has come from PHE.
Yeah. Home Secretary, I think the public will find that very difficult to understand. I mean, I've got a selection of comments here from people who were travelling from northern Italy in early March. One person said, a friend and family returned from Italy today and confirmed no checks on landing at Heathrow. It's like our government don't care or have any plan of action. Another said, I've just landed back at Heathrow from Italy, no thermal imaging, no info on COVID-19, just a bit of hand sanitizer if you fancy. Other people finding it absolutely extraordinary. So I think common sense would dictate, why were we not quarantining or checking individuals coming from other locations where there were substantial outbreaks in March, let alone, February or January?
If you will recall, at the time, people were asked to isolate, particularly from Italy at that time, and there was advice going round, and that was very much the case.
So why did you change that advice on the 13th of March then, Home Secretary, to actually?
Well, as I've said, all advice is based upon SAGE and Public Health England, and that is a cross-government decision that is taken through cross-government decisions and cabinet committees at that particular time.
Did you disagree? Did you disagree with that advice, Home Secretary?
We all follow the advice that is given from government.
That wasn't what I asked you. Did you disagree with it, Home Secretary? Yes.
I have been very clear that I've been at the outset commissioning the advice, raising issues around borders, border security. It's not about me disagreeing at all. We work, and we have consistently shown. I think this is the most important thing, and this is important as well for the public to recognise that it's not just on the borders. This applies to every single aspect of the operational support for the British public, but also for our country in terms of stopping to spread the virus and protecting our people and the NHS, has been based on SAGE and Public Public Health England advice.
Home Secretary, that sounds like you're not quite answering the question. I mean, obviously there will be, I'm sure, a full public inquiry into this in due course. Can you just tell me, did you at any point between the 1st of January, you personally, from the 1st of January to the 23rd of March, recommend closing or restricting the border or formally instituting quarantine other from those Wuhan flights? Yes or no?
Oh, first of all, let me just say, when it comes to the advice on quarantining or self-isolating in particular, the advice is clear. If that you are symptomatic, you need to stay at home, and that applies to absolutely everybody, and that's also people travelling.
But you changed that advice, Home Secretary.
Well, that's for people travelling into the United Kingdom as well.
Yeah.
And secondly, I have commissioned advice, obviously, and rightly so, around border measures, and those border measures have been constantly under review at the time, and I think that was a sensible and responsible thing to do, is query all aspects in terms of protecting our citizens, so that the NHS would not be overwhelmed, to make sure that, you know, we've looked at every single aspect. And in fact, in the Home Office, our own scientific advisor, who is part of SAGE, you know, has been part of those discussions at central government too. And we've been following that advice consistently.
Last question, Home Secretary. On the 13th of March, the Chief Scientific Officer, Sir Patrick Vallance, made his comments, infamous comments about herd immunity. Was the decision on the 13th of March linked to that? And were you effectively overruled by the Prime Minister and others at the time against your best judgment?
No, absolutely not. I absolutely will say, having commissioned the advice, and as I've said, that advice has been constantly under review, and rightly so, we base that on the scientific and medical advice. I mean, that is absolutely clear, and everything that the government has been doing, yes, in terms of actions, not just on the borders, but other aspects in terms of preventing the spread of the virus and protecting the NHS, has been based on SAGE advice. So the two are not linked at all.
I think a lot of members of the public will find this absolutely baffling, that you were allowing individuals to come in without any testing checks or even imposing formally the quarantine requirements on anywhere other than Wuhan. I think it'd be really helpful, Home Secretary, if you could give us a detailed list of locations which flights from the start of the year were quarantined from formally. Was it just Wuhan, or were there other locations? I think it'd be really useful to have a formal list and where quarantines took place.
Of course, we will absolutely provide that, but I will say again that all decisions around borders and ongoing discussions around borders, because this hasn't been a binary discussion at all, this is constantly being under review, has been based absolutely, yes, on the fact that passenger flows have completely fallen through the floor, quite literally, and we're seeing that from the industry, airlines,
but they hadn't before.
etc. But of course, there was a pattern, a change in pattern as the world was locking down, but it's been based on scientific and medical evidence and advice provided by SAGE and Public Health England. And of course, we will be sharing that going forward.
Thank you. Tim Lawton.
Thank you, Home Secretary. We've spent rather a lot of this session talking about people arriving legitimately at port of entry. Can I just briefly raise the issue of those arriving illegally, or those apprehended by Border Force and others in the Channel, and that apparent spike there's been during the lockdown, over 1,000 people who've made land in the UK, and they're just ones we know about. Has something changed in France? Have you had discussions with your French counterpart? Have they relaxed their activity, trying to prevent people getting in the water in the place? Because a lot of people, particularly in the south of England, in my constituency, feel very aggrieved that people arriving, apparently not even being asked then to go into quarantine, and not being taken back to France.
Well, first of all, you're absolutely right to highlight this. This has been a very, very difficult area and a very challenging area. Illegal migration continues to be a very, very difficult and problematic area for us, and you know, we can't. That is just a fact. But you specifically asked about France, and if I can put this into context, this isn't just about France. This is also our wider near borders. So Belgium is also part of this whole this flow of illegal migration that has been taking place over a number of years now, but patterns are changing. And you've rightly highlighted what we would describe as small boats, rubber dinghies. And the pattern has changed much more to that particular mode, to boats, primarily because so many of the other routes have been closed down. So if I can take you back to last October, when the awful, awful tragedy happened in Purfleet, with the 39 deaths of the Vietnamese people, migrants that came over to the country, we absolutely upscaled border security, but actually opening up of lorries. I've seen this myself. I've been on shifts around with border force where refrigerated lorries are not just being scanned, they're opened up, and that trickles through. That goes back obviously to the traffickers, the organised traffickers, the individuals that are facilitating this abhorrent crime, and it is a crime, and they're using different methodologies. So we've seen greater dispersal across the French coast, and we're seeing this now across the Belgian coast. What has happened in France, all credit to the French actually, who, like we are, despite lockdown and despite all the pressures with coronavirus, are deploying all sorts of activity and resources basically in trying to deter. So there is now 24/7 coverage on the beaches of northern France. We are using drones, we're using more detections, we're using ANPR. The fact of the matter is, notwithstanding these French boats, French patrols, these extra patrols on French beaches and using specialist vehicles and detection equipment, too many are getting through. And what we are seeing though, although the numbers are high on those getting through, there are extraordinary numbers, and we do have statistics. I can't share them all with you because currently there are over 20 live investigations into organised immigration criminality involving gangs and facilitators. But we are convicting people. In the last year alone, I understand we have convicted and imprisoned over 111 people smugglers, and there have been over 1,000 incidences of disruption. There is a lot more detail behind every single case, and you are right to highlight this. This is now, we've got the NCA, we've got border force officers in France, there's more work taking place with immigration enforcement. There's a whole range of activity.
Home Secretary, I understand that actually because we don't have much time. Absolutely, it includes Belgium, and there's been displacement, and obviously there are few people coming stowaways on trucks because there are fewer trucks coming through. What I'm concerned about, and what would be reassuring, is there was some good progress last year of French patrols picking up people in French territorial waters and returning them to France. It wasn't just a case of the British had to pick them up and bring them to the UK. Has that activity eased off because the French have taken their eye off the ball, or they've got other priorities at the moment? Are you satisfied that the French are doing as much as they can in collaboration with our security forces as well? And can we get to an agreement, which I think we are trying to get, where we could return illegal migrants who were picked up in British territorial waters to France or Belgium once they came, as I think most people see would be justified?
That's absolutely right. So this isn't perfect at all, and there is more that we are doing on this. I've actually been in touch with my French counterpart in the last week on this, in terms of what more we can do. We have put a proposition forward in terms of new measures, and perhaps, you know, you're very welcome to come in, as I gave the open invitation to the entire select committee to come in.
Sure.
And discuss the issue. It's probably not appropriate to discuss some of the things because obviously the criminality that's associated with this, and this also involves French law enforcement too. There is a lot of work taking place. We have put forward some measures. We're doing this directly through our embassy in Paris as well, but I'm doing it directly with my counterpart in France around returns and returns at sea, which is exactly the point that you are making and referring to. We are also, we are going to go further than that as well, very much looking at, and this is a UK policy area, not just with the Home Office, but the MOJ, about looking at some of the vexatious methods that are being used, but also the vexatious claims around illegal immigration and asylum claims that come forward with many of these illegal migrant activities too. I think the committee would welcome a briefing on this, and you know, I know you were denied the chance to come in, but it's an open invitation. I'd very much hope that you take that up as a committee.
Thank you. Yeah.
When discuss this, you can be cited on the law enforcement work, but actually some of the very diplomatic discussions that are taking place in this space too.
Thank you.
Secretary, I think the clerks have in fact been in touch with the Home Office over several weeks trying to get this private briefing session fixed. So I really hope the Home Office can arrange it, because we have certainly been trying to do so. We need to move on to immigration next. But can I also just clarify, you also said that it was the first that you'd heard of us requesting the science behind these decisions. Yeah. We did in fact ask for that as part of the letter that I sent you on April the 3rd, specifically asked for it, have also chased that since as well. We still don't have an explanation from you on why our decisions around self-isolation at the borders are so different from other countries. The only reasons that you've given why we might be different so far are, first of all, you said we might be different because we had more international travellers. Secondly, you said we might not need the self-isolation because we had so few international travellers. And thirdly, you've told us that you are simply following the sage advice that we simply have not seen. So can I urge you to provide us with that information and advice as rapidly as possible, but also to interrogate it yourselves, because it is still quite troubling that the Home Office itself doesn't seem to have questioned or quizzed or challenged any of the advice or data or information that you've been given. Well, we turn to immigration visas. Yes, sorry.
Well, let me just say, first of all, we'll absolutely provide that to you. It's wrong to characterise that the Home Office has not been probing. We work with our scientific advisor in the department who is directly represented on SAGE. We will get that information to you. And just your point about Home Office briefings, let me put on the record that we have had an open invitation to all members of the committee, and that was declined. So I'm restating that invitation again to all committee members. And I'm sure that we will not just fix up dates, but I did put an invitation in based on thematic discussions that I think would welcome open dialogue and discussion, in the same way that I've been having open dialogue and discussions with the shadow Home Secretary and opposition parties throughout this coronavirus crisis.
Well, it would appear then on that basis we should be able to agree to have such a private briefing on Tuesday of next week, because we have repeatedly said we would like a private briefing. We didn't want one instead of a public briefing. We're very keen to have you here today, but we have also always said we would like private briefings, but we have struggled to get the Home Office to give us a date to do so.
We will organise several private briefings for you.
Janet Davey.
Thank you, Chair, and good morning, Home Secretary. The government has announced that the National Health Service frontline workers and care workers will have their visas extended. There's been no statutory instrument and no written notice to this effect. What is the current legal basis for the extension?
Well, first of all, as you will be aware, in March earlier on this year, I did announce an automatic visa extension for NHS doctors, nurses, paramedics, and those individuals whose visa would expire before the 1st of October this year. And clearly, that is going to make an enormous difference to individuals, around 3,000 frontline healthcare workers and their families. But you specifically asked about the statutory instrument and the legal basis. And of course, as Home Secretary, I'm able to exercise discretion to extend immigration leave in exceptional circumstances. And I think we can all agree these are exceptional circumstances. And we're working with NHS trusts in particular now to identify those who obviously are working in the NHS in the relevant roles and providing the support that is required. So that is something that the Home Office is doing, obviously directly with NHS trusts and with UK VIs. And this visa extension will benefit many nurses, social workers, therapists, people that are working across the NHS, as I said, whose visas were due to expire before the 1st of October this year.
And will this extension go beyond Tier 2 workers?
Well, currently right now, I've been very clear that this is specifically for those individuals who are recognising the NHS, those who have travelled to the UK, Tier 2 visas in particular. But specifically, there are many others, as you will know, that are working in the NHS that are not in Tier 2. So, for example, EU workers who work in all parts of the NHS, in the care sector, who are already covered here with the right to remain under the EU settlement scheme. So everything that we're doing in this space right now is done in conjunction with the Department of Health and Social Care. They obviously understand the pressures, but also the characteristics of people that are employed in the NHS across different NHS trusts. So we're working with them to identify individuals that we can assist through this method, through visas, and be thoroughly as supportive as we possibly can through the workforce plan that the NHS has with the Department of Health and Social Care.
So at the moment, it doesn't go beyond tier 2 workers. Is that what you're saying? And that you're looking to identify who else would be, who this would apply to? Is that correct?
Well, importantly, we are looking to identify, obviously, with NHS trusts and the Department of Health and Social Care specifically, who else this will apply to. That is absolutely right, because there'll be many others that are just not tier 2 visa, that just don't have tier 2 visas. So trying to identify that is difficult. It's not easy to identify individuals, particularly because they'll be here providing different skills and not necessarily came through to the UK through the tier 2 route.
And where can people find this information? Where will this information be?
Well, first of all our information that is specific to coronavirus and the changes that we as a department have made around visas and visa extension is available, obviously through gov.uk, but we're doing this specifically through the NHS, through NHS Trusts working with Department of Health and Social Care, because of course trusts have information in terms of those who have tier 2 visas, and that communication route is absolutely crucial. It really is. So we're doing what we can at a macro level, at a national government level through the centre, but obviously a lot of this is now being cascaded very much through NHS Trusts around the United Kingdom.
Thank you.
Sorry, my technical problems. Holly Lynch.
Thank you very much, Chair, and thank you, Home Secretary. Further to the last question that was just asked, beyond those working in the NHS and social care, there are a whole raft of visa issues that have been brought to the fore by the coronavirus. For all those that have visas who are due to run out, expire, or that require renewal, but are unable to do that or unable to leave the country because of the coronavirus, what clarity is the Home Office offering to those people to avoid absolute chaos for those in that position?
Well, I think first of all, and if I can bring in Shona Dunn on this, because we can talk about our visa operations in particular, and throughout coronavirus, visa operations have clearly changed. But in terms of clarity, much of the information has gone out through our back system through UKVI, which, as you would expect, is the normal approach. But we are still providing support to people that need emergency support around visas and where individual cases are raised. I think at the end of the day, you know, the Home Office is very much a case working department. So knowing the individuals that need help and support, there is a whole triaging process that is taking place to make sure through UKVI people are given the support that they need in terms of, in some instances, getting back into the country. And let's not forget where we were in March, towards the end of the March, when other countries were locking down and there were people of different nationalities in this country that wanted to get back home, providing them the support that they needed. And likewise for British nationals who resided abroad that wanted to come back home as well. And it's not just through the repatriation flights and through the support of Border Force. There's a lot of UKVI work there. But if I can ask Shona to just speak about how our UKVI operations are functioning right now and the type of work that is taking place, and then she can elaborate on this for you.
Thank you, Home Secretary. So on the point about how it's being communicated, just to add to the Home Secretary's points about communications on gov.uk and out through our network, there is also a dedicated COVID-19 helpline that's been available since mid-February. There are 200 staff working that helpline. They have dealt with around 50,000 email inquiries, and they've also dealt with around 25,000 phone inquiries. So we are doing everything we possibly can. As the Home Secretary says, we're an operational department first and foremost, and doing everything we can to make sure we're providing that information to people who, as you say, will have very varying circumstances of our work as possible. But we have, in the first instance, been focusing on those types of casework activity which are urgent or exceptional or compassionate, and also those associated with the most vulnerable. So, for example, the Windrush Compensation Scheme and for EUSS applications. So there are a variety of ways in which we are endeavouring to ensure that those who are most concerned or at most risk are still being serviced by our folk.
And thank you for that. And perhaps before moving to the EUSS, can I just ask, in addition to that, so those with minimum income requirements attached to their visa status, if they find themselves in a position where they've been unable to work due to the coronavirus, or they've got a reduced income because they've been furloughed, for example, is the Home Office working with those to give them clarity that they will not be at disadvantage for those reasons that were outside of their control?
So the Home Office has been, and the Home Secretary has been very clear that any individual that finds themselves affected by circumstances outside their control will not be disadvantaged by that. I can absolutely confirm that the Home Office will work with those individuals to make sure that we are supporting them through that process. There are a number of different ways in which people can meet that requirement beyond their salary, but also beyond that. And recognising the point that it's important that we don't disadvantage people for things they cannot control, we will absolutely work flexibly with people in those circumstances.
Thank you. And Home Secretary, the progress with the EU settlement scheme, given that the settlement resolution centres have closed their phone lines, that a number of pop-up events around awareness have had to be postponed, the centres for scanning documents have been closed, is the Home Secretary minded to consider extending the deadline, which is a very clear window of opportunity that people have to apply for EU settled status?
I think, first of all, the EUSS scheme has been a great success. I mean, since March last year, the 30th of March 2019, more than 3.4 million applications have been received, and over 3.1 million have been granted status. And there is still over a year to apply yet before the deadline. And of course, the deadline is the 30th of June, 2021. I think it's important to recognise as well that throughout this pandemic, there has continued to be a wide range of support. Support has not stopped. Let me be really clear about that. Support has not stopped at all. Support is still available online, by telephone, by email, for those that have questions and need help. And we're still receiving approximately 2,000 applications every single day. Now that is a testament actually to ways of working around this and the fact that communication avenues are open. So we're still providing support. We're absolutely there providing support. And even over a set period of time, since the 25th of March to the end of the 19th of April, we've had already over 20,000 emails have been received. So we're carrying on. So at this stage, we see no reason why, to answer your question, to extend the deadline when there's still over a year to apply.
I think my final point, Chair, is just given the nature and the legacy of the hostile environment with all of these visa issues, there are so many people who are here legally now who just feel in a very, very precarious situation without absolute clarity, with legal underpinning about what their status is and their ability to be in the UK at this moment in time. And the letter that was sent to the committee, dated on the 14th of April from the Home Office, it was unable to provide any further clarity about the length of time to process an application under the EUSS scheme, other than to say that 41% of applications were processed in more than 14 days. We can also see within that letter that 65% of administrative reviews on rejected applications resulted in the original decision being overturned. With some of these additional barriers now in place because of the coronavirus, would you not accept that there's absolute clarity is required for people with a whole raft of visa issues, but that extension may be something that the government has to consider in relation to the EUSS?
Well, first of all, I don't. And the reason for that is primarily because we should separate the EU settlement scheme from wider visa issues. We should not conflate the two whatsoever. And, you know, very happy for part of the briefings next week to demonstrate not only the EU-SS settlement scheme, the processes that go around that, I think would be of great interest actually, and some of the how the decision-making process is actually undertaken. And then perhaps pick up on other visa issues. Visas are complicated, as you know, and that's why I think we do have to separate the two very clearly. But in terms of status, you rightly mentioned the point about legal status for individuals. Look, what has happened in the past, and you know, if we get time to talk about the Windrush, Wendy Williams independent review, very happy to do so. There is a litany, an absolute litany of, you know, historic issues that we as a department need to address. And absolutely, we will be addressing. Let me tell you this quite clearly. No, there'll be no stone unturned here. And I've been very, very clear about that, specifically to the lessons learned review and some of the historical, and I do want to put this within the context of some of the historical activity that has taken place. Yes, around decision making, but also around cases and how people have been treated. And that is something that we are absolutely adamant. I can't be stronger than that. Determined and adamant to change, because people have been treated appallingly in the past in very different circumstances, and that's why I don't want to conflate the EU-SS scheme with this. These are two separate issues, but I think rightly we should absolutely have a discussion, if not today, another time next week in the briefing, about some of these wider contextual issues around how people feel, how they're being treated, around visas, about status, and just the overall handling in terms of casework.
Home Secretary, we're running quite tight for time now. We do have some more questions to put to you on immigration and detention, but Simon Fell has to go to log on to the Prime Minister's questions Zoom separately. So I'm going to slightly rejig the order of questions and just go to law enforcement, if that's okay, and then we'll come back to Stuart MacDonald on immigration. Simon Fell.
Thank you, Chair, for accommodating me, and thank you, Home Secretary. If I can just move us on to county lines. As you'll be aware, it's a big issue in my own patch, but across the whole country too. And I was really surprised when I was talking to my Chief Constable that actually this activity hasn't dropped off during coronavirus. In fact, it's just shifted to new activity happening by car. But it strikes me that we've got a unique opportunity here in the lockdown to really stamp down this activity. So I'm curious to know what the Home Office is doing to tackle this during the coronavirus crisis.
Sure. Well, look, thank you for your question. And I think, you know, I've got to start by just paying tribute to law enforcement throughout coronavirus. They've been extraordinary in their work, they really have. So just to give you some insights, you've asked specifically about county lines, and I think this is appropriate in my response to you. I do operational policing calls every single day. With the policing family, with the law enforcement family, with all the key players, and it is jaw-dropping day in, day out to hear the level of criminal activity. It's fair to say your Chief Constable has highlighted that, you know, they've been able to swoop up, do more gang busting, pick up more drugs and shut down more county lines, because these individuals are out there when the rest of society is simply not out there on the streets. They're more visible and they're more prevalent. But let me just tell you now, I've said this frequently throughout this crisis, the level of crime is evolving, but it's becoming more sophisticated. And with county lines in particular, drug dealers, the facilitators of this abhorrent crime, who still use children and vulnerable people to perpetrate and conduct their business, they are changing every single day their model. You know, they're buying taxis, they're using different modes of transport to what they were using before, and that is how the cops are able to go after them. But in terms of what we're doing, there have been a number of things now. We have very specifically for this year, we have a £25 million investment, which is actually delivering. It's really delivering through the National County Lines Coordination Centre, which is new. It's been established, and that new centre has £3.6 million of funding to work across the entire law enforcement picture. And that law enforcement picture will include, yes, your police force, and yes, your Chief Constable, but also the ROCUs who help, and specialise in serious organised crime and violence, but also the National Crime Agency. You heard at the weekend from the Director General of the National Crime Agency, who just reeled off some extraordinary data around the type of drugs that are not hitting our streets right now. So the environment is quite challenging for criminals that are peddling drugs. I mean, Pakistan, 700 kilograms of heroin was seized. We've had some extraordinary, and I can't share the details, but absolutely extraordinary amounts of cocaine that have been seized, literally just in the last 48, 72 hours, including sort of 4 tons of cocaine that have been picked up and now being investigated. But of course, the focus here is also on increasing all efforts to stop supplies from coming into the UK. And that is why, Border Force, working with law enforcement, have been absolutely just incredible. If I were able to, and this will be subject, obviously, to the briefings that you'll receive when you come into the Home Office, because there's a lot of operational work taking place. The facts, the figures, the data, it's jaw-dropping. But actually that should give us all a great deal of confidence in terms of what law enforcement is doing to effectively cut the head of the snake, the suppliers, stop the suppliers from coming into the country, because this stuff is not grown in the UK, and then obviously getting out there and tackling the perpetrators and the facilitators of these dreadful, dreadful drugs. I did hear this morning, actually, I spoke to Paul Crowther from British Transport Police, and he basically said they've had, even in the last few days, they have found children, obviously vulnerable children, that are still being pimped effectively and used to, as couriers for counterline drugs. But we're able to safeguard them, these children now, because they're so visible, and we're now able to give them the support perhaps in a way in which, when society was functioning previously, was simply not able to do so. There is a lot of work taking place. There is so much more to do. We're working at an international level with law enforcement, not just in Europe, but right across South America right now. So there'll be quite a lot in terms of the briefings that will come your way on this.
Thank you. If I can just pick up on that final point you made around safeguarding, because it is vulnerable people, it is young people who are often being drawn into this activity. But of course, they're not just trafficking drugs now. What we're risking is that they're actually carrying a deadly virus across the UK as they're in pursuit of this. So could you give us some more detail as to what that safeguarding response looks like from the Home Office at the moment?
Well, it's a really important and good question, because we are now working, and we were doing this anyway, working collaboratively. This is multi-agency, so safeguarding of vulnerable people is multi-agency. That is something the committee is fully aware of. But around children, vulnerable victims, this is modern day slavery. This is trafficking of a different kind. This is modern day slavery. We're bringing in new ways to keep both the victims and the frontline staff as well protected and functional, so they're able to still be there to work with the police and law enforcement, to work with social services, to work, with safe houses and accommodation. That work is as strong as it always has been, but it's different. It is different right now, because many of the agency workers that are there, they're now working from home. They're working collaboratively. They're still online. They're working at home. They're working to find safe accommodation. And we're still, making sure that we're funding, obviously, the money is going to where it needs to go. But importantly, as well as doing the safeguarding, we are doing the other end-to-end piece of this, which is ensuring that the perpetrators of these crimes are going to go through the criminal justice system. When we do have, obviously, we have electronic courts, digital courts right now, but that is the other aspect of law enforcement that is applicable to the work that's taking place right now in terms of just going after the county lines criminals.
Thank you. Very briefly, Tim Lawton, who also has to leave for Prime Minister's questions login.
Thank you very much. Home Secretary, very briefly come back to the HS visa issue, because you very helpfully sent a letter to the committee this morning making it clear that it's not tier 2 visas, and saying that other health professionals in the NHS, such as midwives, social workers, and medical radiographers, are being included. Yeah. There's still a lot of people who aren't being included. I have pharmacists, physios, psychologists, porters as well, without whom the NHS doesn't operate. And also we, in our letter, you asked about the extension to social care workers. We know that social care workers and residential homes are very much on the front line at the moment. And your letter, just the disparate nature of the social sector makes it a unique challenge. You're just keeping a review. How likely is it that you are going to extend it? And can we have a full list of exactly those people who will be covered? Because this is very important. The NHS is a large network organisation, and without various components of it, then the whole lot will feel the effects of it.
Well, I think you're absolutely right to make this point. So the answer is yes, of course. We'll be able to provide breakdowns. We do rely on the NHS as well. I mean, for tier 2, it's slightly easier because obviously
Sure.
have immigration details. But because of the disparate nature, different categories, obviously, of individuals that are doing incredible work, obviously, in a sector in the NHS and social care that is under tremendous pressure right now. We rely on that information from the Department of Health and Social Care and obviously from NHS Trust. We are absolutely working, and it is very difficult. I'll be very clear about this, particularly in social care, because many social care providers are independent, but where social care is commissioned by NHS Trust, you know, we'll be able to gather more information and we'll be able to provide that. So of course we'll provide as much detail as we can in terms of numbers and the classification. I think the point you're making, Mr. Lawson, classification, the actual individual roles that people are doing, we will absolutely do that. My only caveat is that we are in we don't have all this information at hand at all. We do rely on NHS Trust, but also we are working with a social care sector that is dominated by independent providers, and trying to get that from them at a really difficult time is very challenging right now. You know, they are focusing on saving lives and looking after people. So that may take time, but of course we will get you information as soon as we can.
That would be very helpful, Home Secretary. We are publishing your letter on the website this morning, and just to follow up on that, this does feel very unfair to the care workers, given that the deaths in care homes now are rising substantially, and also the Health Secretary said he wanted to give care workers parity of esteem. It also feels very unfair to the porters and the cleaners, the people who are scrubbing the virus off the door handles, or who are washing the bedding or the gown in our hospitals as well, that they aren't included in this NHS visa extension. And you are currently asking them to find thousands of pounds, maybe over £10,000 of pounds, to renew their visa and pay the NHS surcharge. Can I ask, have you looked at, first of all, applying the same criteria as the death in service scheme, which the Health Secretary has launched, which goes much broader but still has defined categories? Or secondly, using a statutory instrument, as you've done previously, to simply define groups of people who would be covered? Or thirdly, to simply get rid of the NHS surcharge for NHS and care workers at a time like this? Because to be asking them to pay thousands and thousands of pounds towards our NHS that they are themselves the ones who are contributing towards and keeping going at this time does feel very unfair.
Well, I think actually on the issue of fairness, there is equity. Obviously, we are conscious right now of the status of all NHS professionals. I think we should just be very, very clear about that. This is not about segmenting or discriminating against anybody who works in the NHS. And I'm in daily discussions with the Department of Health and Social Care, as is the department, as am I directly with the Health Secretary. And that is exactly why we brought the measures that we have brought in so far. So I've already said, we review everything. Everything is under review. I must emphasise, though, with social care, we are subject to some difficulties here in terms of understanding and knowing the immigration background and status of individuals, and particularly those that have not come through the Tier 2 route in particular. But I do want to say, even with the immigration surcharge, the health surcharge in particular, that is money that goes to the NHS directly. You'll be aware of that. I've been very clear. We are looking at everything in terms of reviewing positions and policies throughout this COVID crisis and what that means for the NHS. And we want to put fewer burdens and pressures on people. I can absolutely give you that assurance.
Thank you. Stuart MacDonald.
Thank you, Chair. Home Secretary, I think refugee charities have repeatedly said to the department, as they have to me, that asylum seekers are currently finding it absolutely impossible to meet their basic needs on the £36, £37 per week support rate that they're currently on. Why won't the department, or will the department, consider following the lead of the Treasury and increasing asylum support rates by £20 per week so they can meet their basic essential needs?
Well, I think first of all, let me just say, when it comes to asylum provision, obviously our country is very clear in terms of the support that we give to asylum seekers, full stop, not just through this difficult time at all. We are providing accommodation and financial assistance to those in need, while obviously there are limitations upon travel and things of that nature. And that is absolutely in line with our processes and our procedures. And we are absolutely committed to providing the right kind of support in terms of accommodation, provision, financial provision as well. There is no, and I've been very clear about this, if anybody has individual cases that they want to provide to me directly, they can do, but there are a range of protections that are already in place for asylum seekers. And that is something that we are absolutely mindful of and, we constantly look at.
But will we look at the level of support rates that are currently being paid? Because it's been made clear to me that refugee charities are having to spend huge sums of money in topping up the support that the people they work with get, because £36 a week, just over £5 a day, is not enough. Will you look at that urgently and provide the support that's actually needed just now?
So we look at all our policies, we look at them all the time. And as I've said, we look at everything related to COVID and are reviewing that based on the need and the feedback that we have as well. So I think, at the end of the day, we are absolutely making sure that people are supported through accommodation, absolutely, making sure that people are getting the support that they need. And, if we need to do more around funding support, then that is something that the department will absolutely look at. But at this particular stage, our policies and our measures are working, and I've not had particular incidences or cases or examples.
Well, I would just urge you to listen to the refugee charities who are saying that, £36 a week is tough at the best of times, but at the moment it's absolutely impossible. Another particular issue that's been raised is access to Section 4 support. There'll be many, many more asylum seekers whose cases have been refused will be eligible for Section 4 support now. But I'm being told that they are finding it almost impossible to get a speedy response or to access that support. So again, could I ask the Home Office to work with refugee charities to make sure that there's a streamlined process in place and that people are able to access that support that they urgently require?
Well, I think first of all, the answer is yes. When it comes to support, we absolutely make sure that we have support. We do have providers, obviously, Migrant Help. Shona can come in terms of the operational side, in terms of the type of support that we are providing and how we're doing that at this particular time, because obviously we're looking at this through the COVID lens and how functions have changed. If I could bring in Shona Dunn, she can speak to slightly more about the type of support that we are bringing in and the work that we're doing.
Home Secretary. As you say, I think the key thing to note here is that you've been very clear that we are extending to the end of June the ability for anyone who has had their case decided and asylum seekers and refugees to stay in the accommodation that they have been provided. We're also continuing to provide other support, so asylum seekers in dispersed accommodation can continue to get support, as you say, Home Secretary, through Migrant Help and working with NGOs where they have particular vulnerabilities, where they are unable to self-isolate or or social distance in the way expected. So that includes, for example, looking at where we need to provide additional help with food, where we might need to provide mobile phones, where we might need to provide additional welfare support or welfare calls. This is an incredibly challenging time for everybody, and I think the Home Office has done everything it can to focus on the needs of those individuals.
You say everything you can, but you could increase asylum support by £20 a week, and could you also look at access to Section 4 support? Because I understand it's taken an awful long time for people to get access to that.
Certainly very happy to come back to you specifically on the time taken to access Section 4 support. If there is an issue there, very happy to pick it up. On the overall level of financial support, the Home Office does of course look at the level of financial support to asylum seekers on a very regular basis, and we will be undertaking that annual review of the financial support to asylum seekers. I think it's worth pointing out that the basis on which we determine financial support to asylum seekers is very different to the basis on which universal credit is determined by DWP. So we wouldn't automatically.
But that's your choice. That's your choice. If you want increase asylum support in the next few days by £20, you don't have to go through that process. There are other ways you can do it. You have to recognise that this is just as demanding on these households as every other household.
Absolutely. I'm also conscious of the fact that the individuals that receive that support also receive accommodation, also have utilities covered, and so a variety of other support that is provided to those individuals. And that is one of the reasons why the basis on which we arrive at that financial support is different to the basis on which DWP will arrive at the decisions they make. I take the point entirely. We do keep these matters under review. It is under review, and happy to update the Select Committee at a later point on our conclusions on that.
Thank you. Laura Farris, returning to domestic abuse now.
Thank you very much, Chair. Thank you, Home Secretary. You will be aware that the Select Committee published its report on domestic abuse during the coronavirus on Monday. And one of the things that you said this morning is that the situation's moved on quite a lot from March, when some of the issues that you're being asked about were sort of, some of the processes were first put in place. Can I ask you firstly about vulnerable children? Because I think one of the things that we heard evidence on, and I think has become clear, particularly since term started, is that some of the children, vulnerable children who could go to school, are not being sent to school. And we've also had discussions as a committee and with the Children's Commissioner about the ability of social workers to go into their homes. And I was wondering what steps you had in mind for children's services, or what extra protections the Home Office is putting in place for vulnerable children.
Yeah, no, this is a really, really, I mean, look, it's just such an important area, it really is. And, you know, while my department and I have been very clear, we've got a solid strategy on domestic abuse, but I led the discussions probably now 7 weeks ago in government around the role of vulnerable children specifically, and how through the keeping schools open approach that the government has taken, particularly obviously for key workers, we must absolutely ensure that vulnerable children are supported. And of course, the Children's Commissioner has been central to many of the discussions, and I just commend Annie for the work that she's doing here. So you specifically asked about the Home Office and our role in this. This is cross-cutting across government, obviously, so I'm working with Gavin Williamson and the Cabinet Office on this, and many others, because with vulnerable children, there are issues around safeguarding. Safeguarding and protecting them is absolutely crucial. So we'll come on to some of the other issues around children in a minute, but that is the #1 focus. And working with, obviously, MHCLG, who are central to this in terms of the role of social workers, making sure that from the data, you know, we've just been speaking about social care and how there's an independent structure there, but with schools, again, the independent structure around schooling, obviously, with academies and how they have data and information, local authorities have information about children, has to feed into the work of central government too, and the type of support that we can actually provide and give. So central to this, this is not Home Office specific, but it is government, obviously cross-government, is understanding who those vulnerable children are, kids on care plans, you know, kids that have been identified as vulnerable for all the so many awful reasons that we know, for safeguarding reasons, and how some of the schools, local authorities, with support from central government, are then bringing that information and data together to then provide that support so that social workers are still keeping in touch. It's that keeping in touch which is just so essential, so vital and so essential. So that work isn't obviously not Home Office led, it's MHCLG led, but it's being overseen by Cabinet Office, and there is a particular committee public service committee where this is looked at and it's reviewed on a weekly basis. So there's that work taking place. Children's Commissioner feeds into that. We're all heavily involved in that. I come into this specifically, obviously child protection, safeguarding, the criminality side, obviously the information that we pick up obviously through law enforcement, but actually schools as well. You know, we're all part of one big network, and ensuring that those children that are still vulnerable need to be safeguarded, protected from violence in particular, and protected from harm. You know, we want to make sure they're protected from harm, but also that they are being fed, because obviously the purpose of keeping schools open was to give children, yes, the fact that they, you know, could be safeguarded, but making sure that they're being fed and that their families are being catered for as well. So there is, I think, what I can describe in the ever complicated world of central government, but that multi-agency approach that is still taking place. It's, you know, it's a really difficult area. It's really sensitive as well for all the reasons that we know about. Every child is different. Every child has unique circumstances around them.
And then the other two questions I have are about the funding allocation that's been made to deal with domestic abuse and the sort of what I think it would be fair to say now have sort of preliminary evidence of a spike in domestic abuse. There were two things that came out of the evidence sessions, again, we had with the Domestic Abuse Commissioner and the Victims Commissioner, and also some small groups from women's refuges. IMCAN was one of the groups who appeared. So quite a large amount of funding has been made available, but there was a concern that that was going to be distributed by local authorities and PCCs.
Sorry, carry on.
Well, I think you may be able to answer it, but there was, I think, IMCAN in particular was sort of an example of a group that wasn't really plugged into those networks and said we wouldn't necessarily be within their on their horizon. And I was wondering what the answer was on that.
Yeah, so I have very strong views on this whole issue. So first of all, look, I've been very, very clear about support around domestic abuse and hidden harms. On the children's side, there's a lot of work that's been taken place, obviously, with online abuse and things of that nature. But specifically on domestic abuse, a number of points to make. First of all, the support that has been asked for, so I'm going to be very specific with regards to COVID. We have seen, you know, we've got information. We do not have, and I should be clear about this, obviously from refuge helplines, etc. We've seen a surge in demand. Obviously, that's more calls coming in and more referrals online. Policing data shows that there are no trends per se, but obviously we've got to collect that data and aggregate that over time. Policing has made domestic abuse an absolute priority, and so I know of one police force, we've seen loads of arrests. The Metropolitan Police published some data at the beginning of the week or at the weekend on the numbers of arrests they've been making. I've seen much more data in this space. But specifically to funding, on funding, we are working directly with the sector, so a range of organisations in the sector. So you have big, medium, large, you know, small ones as well. The support that we have provided. So first of all, if I can just speak about the £2 million.
Secretary, can I just interrupt for a second? We still have Deanna Davidson and Adam Holloway to ask questions.
Okay.
Do you mind going an extra 5 minutes longer? You can carry on answering the question.
Of course, that's absolutely
fine. Thank you.
So just on the £2 million that I have allocated and announced, that's straight from the department, that is specific to bolster and support the capabilities, the capacity that we are basically hearing there's a need for from the organisations themselves. So that is for domestic abuse services, because let's not forget their ways of working have changed as well because of lockdown. People are at home, they're working from home, they've needed laptops, they've needed specialist helpline support, etc., etc. Now there's a bigger bid. The Chancellor announced a bid of £750 million that will go to charities, and I specifically asked him to reference domestic abuse charities, and he did that. There is a bid that I'm working with him on right now for a substantial amount of money, which will come, obviously, that's got to go through a proper financial process. I have already said to the Domestic Abuse Commissioner and to the Victims Commissioner as well, in a discussion that I had with them on Monday evening, very specifically, that they must have a role to play in working with the Home Office on the allocations and the type of organisations this money goes to, primarily because they are able to, and I think we're able to, get a much more holistic view of the sector and where there are needs, basically, to provide less bureaucracy. At the end of the day, you know, once we've gone through a funding process through central government and that money comes to the department in the right kind of way, we should absolutely be able to disseminate that working with third parties. So that is absolutely what we will be doing.
I had another question, but I don't think there's time, so I'm going to hand over to one of the others. Thank you.
Deanna Davison.
Thank you, Chair, and thank you, Home Secretary, for agreeing to be with us today. On the funding for to support domestic abuse charities with regards to helplines, etc., when is that funding likely to hit the front lines?
Well, that is something. So first of all, we're working with the Treasury right now on bids. So I've put specific bids in. And so obviously we've got to come out through that due diligence process. There are lots of things. Anybody, you know, when you work in government, there are absolutely financial appropriate measures that we have to go through. Once I know what those allocations are, I've been very clear to both the Domestic Abuse Commissioner and to the Victims Commissioner. We'll be working to effectively get that money in the department and then get that out immediately. And I will work with the Domestic Abuse Commissioner and the Victims Commissioner on that. I think it's important those that work in the sector understand where the needs are, where the demands and pressures are working with us to facilitate that money going out, that support going out. We've got to do this in the right kind of way so that we have the right kind of financial efficacy, the right model around this. But, you know, it is my priority to get that money to people ASAP. But at the same time, you know, we've been working with the sector. That support that they've been asking for has been factored into the bids that we've put through to Treasury. So the objective is to get that out soon.
But specifically on the £2 million that's already been announced, has any of that hit the front lines already?
Well, we're already putting that out because that 2 million is being spent in I guess in doubling up, you know, in terms of providing additional support, because it's about capacity. So technological support, for example. So we've done a deal with Fujitsu, providing expertise, specialist helplines. That is already going out. And, you know, what will come forward is separate to the 2 million. But there are processes that we have to work through, and rightly so.
Brilliant. And then just a question really on exiting from lockdown, because obviously much as we need to look at the situation now, we also need to look ahead and start planning for the future. So what work has the Home Office been doing in order to plan for kind of the strategy coming out of coronavirus?
So there is a cross-government strategy, and on this point I should bring in the Permanent Sec, Matthew Rycroft, because he's been working across government on this. But specifically to the Home Office, it would be remiss of me not to factor in, I mean, we have a wide range of stakeholders, you know, a wide range of Home Office issues that have to be considered in alleviation measures from moving out of lockdown in a calibrated way. Law enforcement and policing is one of them. If you look at the remarkable work of policing right now and the legislation, the regs that came in back in March, you know, for the 4 E's around engagement, around community before we get to enforcement, policing has been central to that. So policing and the Home Office as a whole are working with the Cabinet Office in what is quite an extraordinary piece of work right now across government. But can I bring in Matthew, because Matthew is heavily involved in this and he can provide you some insight specifically on the work that he's leading here.
Secretary, thank you, Chair. And can I begin by thanking you for your warm welcome and to say how much I look forward to working with you as you hold us to account on the important work that the Office does. In answer to the Home Secretary's point about the governance for the COVID response and the Home Office's involvement in preparations for whatever comes next, I can reassure you that the Home Secretary herself, through the ministerial implementation groups, and Home Office officials through our involvement in our groups are absolutely central to the cross-government work. And we just need to make sure that the health aspects, the economic aspects, and if you like, the Home Office aspects are all taken forward in parallel, and it's our job to ensure that happens. There's a lot of work going on, as you'd expect, looking at all of the different types of measures at the moment and potential future measures to ensure that they are enforceable, working with our brilliant law enforcement partners, and making sure that all of the risks and responsibilities on the Home Office side are taken account of.
And one specific issue that's been raised by my own Chief Constable is a concern about when lockdown measures start to be lifted, particularly for licensed premises, whether that'll create a sort of cliff edge whereby no one's using the pubs, then suddenly, there's a huge rise in demand, which could lead not only to issues in terms of crime, but also in terms of the virus spreading. So is that something that's being considered?
Through the daily calls that the Home Secretary has with police chiefs, they have made those sorts of concerns abundantly clear, and the Home Secretary is using that knowledge and that insight in those relationships to take forward those sorts of issues in that cross-government plan, which is well underway.
Thank you.
Thank you. Adam Holloway, who is on audio.
Thank you, Chair. Firstly, can I thank you and the civil service and the government on behalf of the vast majority of my constituents, irrespective of how they vote, in how you've been dealing with this miserable situation.
Thank you, Adam. It's been extraordinary, I have to say, and I pay tribute to everybody. It's been such a privilege to work across policing, law enforcement, but actually the civil service as well, to just look at the way in which everybody has been operationalising and coming together. Plus, I have to say to the British public, as I've said publicly previously, the spirit of national unity that the country has shown at the time of this health emergency has been really quite remarkable. And the way in which the public has kept going, I think, inspires us all. It really does.
Yeah, so thank you very much. On to the exit strategy. Now, clearly, it's all about protecting NHS capacity in order to save lives. However, thank God, the NHS is not currently at capacity. So is there an argument on a trial and voluntary basis to unlock specific work sectors based on specific geographies and based on individual risk profiles, whilst also kind of balancing the risk to NHS capacity and obviously keeping the row number beneath 1?
Well, thank you for that. I mean, look, there is a lot of work. Matthew has just touched on this that's taking place, and there are lots of assessments. I'm not at liberty to go into the details of some of the discussions that are taking place. But I think, the fact that, for example, testing is now dramatically upscaling. So clearly that will have an impact now in terms of giving, hopefully, greater public confidence to people to eventually go back to work. But even before people go back to work, there is a job to do yet still in terms of securing workplaces. The fact of the matter is we will not go back to how we were in early March. There'll be new norms that will inevitably come off the way in which social distancing has now dominated our lives and is affecting society. So social distancing, even in my own place of work right now, is taking place. We would expect social distancing in every single work area, whether it's an office or a construction site, social distancing on public transport going forward. These are all active things that, rightly so, we have to test, we have to put through consideration. And there is an argument, rightly so. We have absolutely, I think everybody across government has worked night and day to ensure that the NHS was not overwhelmed and that we could protect the NHS by growing capacity. If we come back to those 5 tests, making sure that there is a sustained and consistent fall in the daily death rate, but also showing a decrease of infection. That in its own right will have an impact upon the R value. And then, of course, making sure that we can operationalise. The fact of the matter is, to move into a new normal, we will, as a society, have to operationalise new ways of working. And of course, they have to be tested. Employers have to embrace those. Guidance will have to come from government. I know for a fact, even from a Home Office perspective, the work that we have done from an operational perspective, whether it's with Border Force, whether it's with our passport offices, we've had third-party assurance as well on our own office spaces in terms of the measures that we've been put in place. That is now being fed into the Department of Business and into the Cabinet Office in terms of how we can get the public sector working, but also looking at how we're social distancing in our offices as well. It's being fed into some of the guidance and the work that BEIS are undertaking. So there are so many work streams taking place, but you're absolutely right. We have to consider all of this in terms of then looking at how because we cannot remain in this situation indefinitely, but how we then move into that phased, calibrated approach. But we're obviously going to have to lead that. We will be leading that through putting guidance out there into the public domain to employers, engaging with trade unions, the department and the government are doing, and many others.
Can I just make the point? One doesn't have to do everything at the same time, and also that the row should, on average, be below 1, although you could let it run higher elsewhere.
No, absolutely, and that's my point about having a calibrated and phased approach. We can't do everything all at once. There is no doubt this will have to be looked at through that very lens, through this phased approach that everyone is looking at and considering in government right now.
Thank you. Thank you very much, Home Secretary, Permanent Secretary, Second Permanent Secretary. Very much appreciate your time, and convey again, once again, our thanks to all of the staff and the organisations and police forces that you work with as well. We will have, there were a few questions we weren't unfortunately able to cover. We hopefully maybe will be able to do so at the private briefing on Tuesday of next week, or we will write to you. I think Laura had some further testing for police officers, and that would also cover, I think, border force staff, and also testing at airports would be helpful to have some further information from you on. I would also just finally highlight one of the points in your letter that we've published this morning, which we haven't covered, but I think was immensely important, was we'd asked you previously about what the provisions would be for the families of those who died while, tragically, while on the front line in both social care and the NHS. And can I just strongly welcome your confirmation that the dependents in that sad situation will be granted immediate indefinite leave to remain without a requirement to pay a fee. We welcome that. Can I also just ask you to look further again, given that the Foreign Secretary has just confirmed that 23 care workers have died from COVID-19 now, to please look again at the visa extension issues around both care workers and porters and other hospital staff, cleaners and so on as well. And we also finally look forward to the further information that you have promised us around the science and the scientific advice to the Home Office. That would be immensely welcome. Thank you very much for your time today. Order, order.
Thank you.
Thanks, Priti.
Thanks very much, Beth. Thank you. Nice to see you all. Thank you.
Home Affairs Committee, 29th of April. Home Affairs